Hello and welcome to another virtual offering for National Family Caregivers Month. We are joined by Heidi Vokes, and she is going to give us a presentation on My Healthy Vet and all the things that My Healthy Vet can do to support a veteran and their caregiver. So I will pass it over to you, Heidi.
Hi, thanks so much for inviting me and having me to share some of my knowledge. So, real quick, we will go through a brief presentation that I believe was created by members of the Sioux Falls Connected Care team. So, bear with me if I stumble through some of them. So just a quick disclaimer, this presentation will be recorded and posted to the Sioux Falls VA Healthcare System YouTube channel for public viewing. Please do not share any personal identifying information about your individual situation. Okay, so a quick overview of what we're going to discuss today is what is My Healthy Vet and the changes that you will see with it being moved over to va.gov, how to create an account with either login.gov and ID Me to access your My Healthy Vet account on va.gov. If we have time, a brief website demonstration of va.gov. We'll go over a few of the VA mobile applications that are available to you as veterans as well as caregivers, and then a brief overview of the Vision 23 connected health contacts. So My Healthy Vet is the VA health portal for essentially it's the veteran health portal for healthcare. So in the private sector, a lot of people call it My Chart. Ours is My Healthy Vet. A lot of people heard the rumor that it was going away, that VA was getting rid of it. No, we will always reference and call your healthcare information online My Healthy Vet. We may move it, and I hope they don't move it for another decade, but My Healthy Vet is what you will be looking for anytime you go to access your health information. Currently, you will be able to access that via va.gov or the My VA Health and Benefits application that you can find on your cell phone app store. So the different features of the My Healthy Vet is you can manage your appointments, you can send secure messages back and forth with your clinics, you can manage your medications by refilling them, reviewing your medication lists. You can, on the website, access medical records. You will have links to pay.gov and the travel website Beneficiary Travel to file and review travel claims. And we also now have the ability to order hearing aids and CPAP supplies for those of you who need those. With the new website and mobile application is a new way to sign into our system, and that is where ID Me and or login.gov come into play. Okay, so you're probably familiar with them or have at least heard of them, because it's not just the VA that has gone to these logins. Social Security, IRS, federal benefits, essentially most, if not all, government websites use one or the other to log in. Okay, security wise, they are equal. Okay, So if you have one and not the other, it's okay. One is not better than the other. It's just you may have used ID.me for a discount at a local retailer. You may have used login.gov to access your retirement benefits if you've retired from federal service. So the biggest difference between the two is that if you say travel to Mexico in the wintertime, or if you currently don't have a state issued ID, or you're one of the few people that don't have a social security number or things like that, then ID.me is going to be the one that you have to choose. Login.gov is maintained by the US government. ID.me is maintained by a non-government agency. So ID.me is one you would have used if you've recently had a phone number change, if your phone plan is in somebody else's name, because they use I like to call it the trifecta to verify your identity. What that means is they use your driver's license, your social security number, and your phone number to verify who you are. So if one of those has recently changed, then ID.me, we can easily connect to a representative via video with a secondary documentation and get you verified. Whereas login.gov, it's not as easy because they tell you they're going to mail you a code in 5 to 7 days. And a lot of times that code doesn't seem to work. So if you have one of those situations where you can't verify with login.gov online, then I highly encourage you to use the ID.me application. All right, so when it comes to create an account for a veteran, so you as a caregiver, if you need to create an account for the veteran, you need to ensure that you are using the veteran's information, okay? I know a lot of times you are the one that are handling their medications, you're handling their prescriptions, you want it to go to your email address. That's great. You can have all of that happen still. However, the email address that you create the ID.me or login.gov account with needs to be specifically set up for the veteran, meaning it needs the veteran's name associated with it. It needs the veteran's social security number, all of the veteran's information, because 10 years down the road, 5 years down the road, you don't want to have to remember this conversation we're having that, oh, my email address is set up to my husband's information. I don't know what I'm supposed to do because I need to get into Social Security. So, because you are going to need your own ID.me account or login.gov account to get into government websites as well. Most of you, if you are set up with our caregiving program, are aware of this because you've had to use the ID.me program to set up your direct deposit. Okay. If you have issues setting up an account for your veteran, ID.me, login.gov, they do not care about power of attorneys. They don't care about any of that. We would need a court-appointed guardianship or conservatorship in order to set you up with secondary options for getting into the website. Unfortunately, that's not a VA rule. That is something that goes way beyond us. So without having that court-appointed conservatorship or guardianship, we're at the mercy of login.gov and ID me to verify their identity. Okay, so I know that we do have some veterans that are at advanced stages of care and can't answer certain things on their own. So that's why we try as hard as we can to get everything set up through the self-service option when it comes to working with our caregiving program. If you have questions, don't hesitate to reach out to your local connected care representative at your facility, because I know that they do reach out to our national team to see what options there are. But as the most recent national call, we are still at the mercy of IDMe and login.gov. So for creating a caregiving account, I know I just touched briefly on that. Caregivers ID me is what you want to have. That's the only program that you can use to get into the website that manages your direct deposit. So if you need help getting your ID me account separated from your husband or your veterans information so that you can successfully get your information attached to the ID me account, again, please reach out to your connected care representative. We do have a way to reach out to ID me support to try and get that rectified for you. Again, one email address per verified individual. So if you are using your email address for your husband or your veteran and it's already verified with them, then you would have to use a different email address for yourself. Okay. It goes for if you are the caregiver for your parent. I highly encourage you to create an email address for them or use your backup email address. Okay. The important emails will not redirect from the VA hospital unless you update their profile. So the ID me username, login.gov username, that's all it is. It's just a way to get into the website and get your identity verified. Profile, whatever email address is listed under the profile, that's the one that's going to receive all of the emails from the VA. Okay. As far as phone numbers, same thing. Unless you update the phone number in the veteran's profile, all of the important appointment reminders, phone calls from the VA, they're going to still go to whichever phone number is in the profile. We only need that initial veteran's phone number to verify their identity, okay? If you don't change it in the profile after you verify their identity, then it will stay just as it is. Okay. Demonstrations will be posted on YouTube.
So this is a part, if we have time, would you like to demonstrate like where they would go on the website, like on my healthevet to make or where would they find the list of appointments or prescriptions? And we can do that at the end if you want,
Okay,
Heidi.
yeah.
Or we do that. Yeah. Mm-hmm.
Yeah, that we can do that at the end.
Okay.
So VA mobile app store is available to veterans and their family members. There are various different apps that are out there. Okay. And these are all available to you at no charge, okay? So you can see which will work best for you. Some of you may already be familiar with the Annie app. That is a text message reminding system. It's also available for motivational messages, things like that. We also have apps that are available for tracking your health. So if you utilize the Share My Health Data app, you can hook up your Bluetooth devices, whether it's your scale, your blood pressure machine, your glucose monitoring machine, and tracking that information will transfer directly to your electronic health record. So you can let your provider know, hey, I have a month worth of data from my blood pressure machine. It's been consistently within range, so I don't feel like I need to come in for an appointment. And your provider can then go into your chart and see for themselves where your blood pressure has been tracking. And if they have reason to see you for an appointment, they can say, hey, you can come in, or hey, you're right, maybe we don't actually need to see you in person. Your blood pressure is looking really good. Why don't you continue to monitor it? And if you have any concerns, you can send a secure message. Over here, you've got the VA Health Chat. In Vision 23, you can open this up and connect with a live pharmacist or nurse, I believe till 7 p.m. Central Standard Time every day if you have any questions about a health concern or a medication issue. So that's extremely helpful. Say if you are trying to decide whether or not you should make an appointment, or do I need to go to the emergency room? Do I need to go to urgent care? Or you don't know why a pharmacist switched out a prescription. Like, they're usually online within 1 to 2 minutes of you connecting. And then the VA Health and Benefits app, that's here. That's our new mobile app used for your veteran benefits and your some of your health information. It does not have all of your health information because apps are not as secure as websites. So if you want to see all of your appointment details, you're going to want to go to the actual website. If you want to look at your actual medical records, like your lab results, your doctor's notes, you're going to want to click the link that will take you to va.gov, okay? So yeah, this is just a brief overview of what the Share My Health Data app does. It also allows you to, if you wear a fitness tracker, a fitness watch, you can connect it to the Share My Health app. It also allows you to manually enter that data as well. And this is talking a little bit about the Annie app. Annie has self-subscribing subscriptions as well as clinically assigned subscriptions. And these are the different facilities within Vision 23, and it looks like it lists all of the connected care representatives' phone numbers. All right. So this here is our website, va.gov. Okay. And you're going to click sign in. And then you're going to use either ID Me or login.gov to sign into the website. Okay. When you sign in, if you're on your mobile device, you will not see these two tabs here that say My VA and My healthevet. Okay. You will only see your name with the little head on the top. When you click on your name with the little head, you'll see the My VA and the My healthevet tabs. Okay. If you need to update your contact information, if you need to update your veterans direct deposit information, you're going to click profile. Okay. And then you're going to come into contact information and manage contact information. When you update your contact information underneath this profile, this will update your electronic health record within minutes. Okay, so if you're somebody that goes south for the winter, this is where you'll come to update your mailing address. Okay, so that way you don't have to try and track anybody down within your facility. You don't have to try and get a hold of anybody on the telephone. You can just come in here yourself, update your mailing address, and then be on your merry way to your southern destination. And then the same thing when you come back from the south, okay? Update your mailing address when you get back home, so that way, and do it before you order your prescriptions, because otherwise your prescriptions are going to go to the address that you didn't update, okay? So before you refill any prescriptions, update your mailing address, okay? And then this is also where I was saying that if you don't update your email address or phone number under the profile, then you don't have anything to worry about things changing with login.gov or ID Me, okay? This is also where you update your direct deposit information. I know a lot of our smaller banks are getting bought out by bigger banks, so you can update your direct deposit here if you need to change anything with monthly beneficiary checks. Okay. Here you go to My Healthy Vet. With the new update and them switching it over to va.gov, they did a lot of simplification to the website look, as well as how you can navigate it. So across the top, you've got appointments, messages, medications, and records, as well as if you scroll down, you've got everything as well. Appointments, messages, medications, medical records. And then here's the payments we talked about, as well as the medical supplies that we talked about. Okay, if you need to pay a copay, you can select this link right here. If you need to review or file a travel claim, I'm going to recommend that you don't click this button, but you come up to your appointments and go to your past appointments. Because when you go to your past appointments, you'll have a link to file a travel reimbursement. And you can select that. And of course, the website is down for maintenance. But it'll walk you through, I believe there's 3 or 4 questions, and then it'll submit your travel claim for you. If you've already filed your travel claim, you can come here underneath past appointments and scroll to the bottom, and you can check your claim status. And then it'll tell you, if the site wasn't down for maintenance, the status of your travel claim. But if you notice how we are clicking in and out of things down here, but you still have the view of appointments, messages, medications, records. Okay, so when you're in here, you can't break it and you can't get lost, because I can still click in and out of things. Okay, so if you want to start a new message, you can just click to start a new message. Okay, medications. Don't forget to use your filter list, because it'll automatically give you access to all of the medications that you've ever been prescribed, and just focus on your active ones and then apply the filter. Okay? If there's a little truck here, that means your medication has shipped. And then you can click on it and track it with UPS or the Postal Service, whichever shipped it out. Medical records. No longer do they hide your medical records under something called the blue button. They've labeled them as medical records. They've broken everything down between labs and test results, care notes and summaries, vaccinations, allergies, health conditions. And you can select into any of these, and it'll break down all your notes and summaries. These all go back to 2013. And then each signed note in your chart is going to be a different link. And to go back, you just have to click back to medical records. If you want to look at your blue button, you just need to scroll down, and then you've got your blue button still. And then this, you can select your date range. You can do all. You can do labs. So the world is your oyster when it comes to it, but notice you've still got your My VA tab. You've got your medications, messages, appointments. If there is a line through your appointment has been canceled. My VA side will give you your benefit side of things. So if you have an active claim in process, you'll see it under claims and appeals. If you go up to your search bar, if any of the spouses have CHAMP VA, and if you have questions about CHAMP VA, you can type CHAMP VA into your search. And then you'll be able to pull up your CHAMP VA benefits. And then this here will tell you how to get dental and vision. And it just kind of gives you an overview, and it breaks down the different benefits of CHAMP. If you click on this here, it brings you to the actual CHAMP VA guide, which is right here.